Most newborns are tested for serious health conditions right after they're born, and 2 more conditions are under consideration in Vermont. Currently, 33 core conditions are screened in blood testing, although dozens of secondary conditions are also picked up. The conditions come from the Federal Recommended Uniform Screening Panel, or RUSP. Now, different states in the U.S. pick and choose which conditions they want screened for at the lab. 2 new conditions were recently added to RUSP, but it's unclear right now whether Vermont will add them to the state's list. The health department has an advisory committee to help determine which conditions get included in the screening.
That process involves various stakeholders, medical providers, families, payers, and the process really looks at the availability of tests, the benefit of the screen, and the availability of treatments.
Vermont's newborn blood samples are tested as a part of the UMass New England newborn screening program. The lab is currently assessing the capability of testing for the 2 new conditions. Director Dr. Roger Eaton says one consideration at play is cost, including supplies and specialized personnel. In the meantime, they test for newborn conditions in 5 states. Eaton calls the tests they're doing essential to notifying parents of silent conditions right away, because babies can appear totally healthy at birth.
If those clinical signs appear at a time when irreversible damage has already been done, we as a medical community have missed the opportunity to vastly change the quality of life of that baby. Because by the time the condition becomes clinically apparent, it's too late, then you really need to test every single baby born.
Now, parents can opt out of the newborn screening program, but that is rare. What's also rare is getting diagnosed with one of these conditions. While abnormal readings are flagged daily, the health department in Vermont reports only about 100 positive diagnoses in the past 10 years.